No one likes to talk about suicide, but a Nemaha County family says that's exactly why we need to. September is Suicide Awareness Month, an issue the Quigleys never imagined they'd experience so personally. In tonight's To Your Health, Chief Photojournalist Doug Brown and I saw how they're turning their pain into purpose. Messages dot the streets of Corning, Kansas and the Nemaha County countryside. You're tough, you're beautiful, all fulfilling a purpose.
He was so full of life. He was the kid who was the daredevil.
Damon Quigley was 13 years old.
He loved sports. He wasn't afraid to try anything new.
Yeah, he was a fixer. He liked to fix people. Yeah. He cared about your issues or whatever it was, and he just wanted to help you.
But Damon wasn't fixing himself.
Bye, love you. Bye, love you too, Mom. Just an ordinary morning.
January 19th, 2021, Damon, home alone and away from friends on COVID-related quarantine, took his own life.
We actually didn't know anything was wrong. He must have worked really hard at keeping it from us for whatever reason that we'll never really know. He just buried it so deep.
There weren't any indicators.
Brenda, Ron, and their two older children decided as a family to be open about what happened, first including it in Damon's obituary.
Our reasoning was, if we can't talk about it, then isn't that just perpetuating the idea? Just don't talk about it.
And more too, to break the stigma of it's a bad thing to talk about. That's, I think, the point we want to get across is that, you can talk about it and you need to talk about it.
They channeled their pain into purpose.
Maybe that's Damon's purpose, is to save another life, is to save someone who's having those thoughts, and that person thinks, okay, well, I heard it's okay to talk about it. So Damon's purpose is to promote mental wellness.
Brenda started posting to Facebook with the hashtag Damon's Purpose. When they invited people to create signs with positive messages, their home overflowed.
There were people sitting on the floor. There were people outside.
Hundreds of wristbands bear the message,
it is okay to not be okay.
And Centralia's school allowed them to make over a staircase, telling students, you are worthy, you are enough, you can rise above whatever demons you face.
I guess my biggest prayer is that kids are able to verbalize what's happening. Even if they don't know what to say or how to start the conversation, they can at least say, I haven't been feeling like myself lately.
Very critical for that first step so that we can step in and be able to support them when they need that support.
Brad Chapin of Stormont Vale Behavioral Health agrees there are many people like Damon who don't show outward signs of struggle, so people need to know they're not alone.
Struggle is a human factor, and so getting that message out there and that there is hope, because not just the fact that we have struggle, but we also have things that work when we feel like we're struggling.
Each time someone reaches out or visits the tree planted in Damon's memory, the Quigleys see signs the message is taking root.
You're so loved and needed right here. You have purpose right here.
And Damon's purpose now is to encourage others to speak up so their silence doesn't stretch forever.
We would like for people to see that it's okay to not be okay, but it's not okay to suffer in silence. You have to reach out.
If you or someone you know is struggling, you can call the Suicide Prevention Lifeline anytime, 24/7. That number right here, 800-273-8255. You also can support awareness efforts with the Shawnee County Suicide Prevention Coalition's 5K Run Walk. It is virtual, so you can do it anytime next week. I have that link and a lot more resources on the health page of WIBW.com. Another jump in COVID clusters in Kansas schools. KDHE's update today shows 5,700 new cases. There is the upward trend line, along with 142 hospitalizations. That number reflects since last Friday, a little bit more time in that time frame because of the holiday weekend. This week's update on clusters shows 177 active clusters. That is up a handful from last week's report. 31 are in K through 12 schools. That is 10 more than last week. Also 22 in daycares, the most, 62 in long-term care facilities. 8 of the schools are identified as exposure locations. That's 5 or more cases in the past 14 days. 2 of those are in our area. St. George Elementary in the Rock Creek District has 22 cases. Also Quail Run Elementary in Lawrence with 5. Other exposure locations this week include the Shawnee County Jail and KNI. COVID clusters in Kansas schools held fairly steady over this past week. KDHE's update today shows 60 clusters, the purple piece of the pie there, in K through 12 schools, accounting for 569 cases. That is up from 56 last week, but it's down from a high of 79 in late September. The report does show one potential trouble spot in Great Bend. Their high school, middle school, and 2 of the district's 5 elementary schools in Great Bend are all listed as exposure locations. Those are places with 5 or more cases in the past 14 days. In our area, KDHE shows exposure locations at M&M Sweet Home Daycare in Emporia, Aventa Living on 10th, that's a long-term care facility, and another retirement facility, Heritage Gardens Health and Rehab in Oskaloosa, also on the list. KDHE did report 2,100 new COVID cases since Monday, but checking the trends, we haven't done that for you in a while. Here is how the daily case numbers are going. You can see from that spike in September, they are starting to go back down. The same when we check the hospitalizations, they also are now starting to trend back down again. The Safer Classrooms work group. The latest COVID reports show some encouraging trends, but health officials still urge caution. Here's why. This is the latest CDC map. It continues to show high community transmission in all but 3 Kansas counties. Riley and Montgomery still are at substantial levels, moderate in the yellow there in Graham County. KDHE showed 143 clusters this week. That is down by 21 from a week ago. 45, the purple slice of the pie, those are in K through 12 schools. That is down from 51 last week. We do have a few exposure locations in our area to tell you about this week. Those are places with 5 or more cases over the past 14 days. Among the schools, those include Emporia Christian School, Valley Heights Junior High, and also USD 429's pre-K through 8 building, through 8th grade building. That is in Troy. Also on the list, Seaman Middle School Wrestling, the Georgia Pacific facility in Blue Rapids, Christian Challenge Group that is meeting at 12th Avenue Baptist Church weekly in Emporia. Also Lansing Correctional Facility back on the exposure location list this week as well. One other trend we want to take a look at, and that is how COVID is affecting our hospitals. This graph shows the adult COVID hospitalizations. This is last year at this time. We were right in here on that uphill climb that had hospitals scrambling to add extra space. It peaked in January, and then you can see we fell back off, started to climb again. This is August and September, and here's where we are now. The numbers about half of where we were a year ago and trending down. However, that is not to say hospitals are out of the woods. KDHE reports 75 new COVID hospitalizations since Monday, and hospitals are seeing a lot of other serious illnesses, non-COVID respiratory illness, and dealing with those staffing shortages we've been telling you about. So we will continue to keep an eye on how that trend progresses. The state of Kansas has reported a 6th child death related to COVID, as well as an uptick in school-based COVID clusters. A few things I want to show you today. The Kansas Department of Health and Environment's Wednesday update shows 3,000 new cases since Monday. And if you take a look at this graph, you could see how after trending down, we went back up, went back down, and now these past 2 weeks, case numbers have gone back up. On the bright side, we take a look at the adult COVID-related hospital admissions. That line is continuing to trend down. But among the new deaths, a child in the 0 to 9-year-old age group. KDHE says the child passed away earlier this month. They declined to provide any additional information on that. As for the clusters, the weekly Wednesday update from KDHE reports 152 active clusters in all this week, up from 143 last week. 54 of those, that purple slice of the pie, in K through 12 schools, encompassing nearly 700 cases. And here's a look at how those numbers have trended since the school year started. The 54 this week is up from 45 a week ago. That high of 79 the schools hit in late September. But we also saw 19 schools make the exposure location list this week. week. It was only 7 a week ago. Those are places with 5 or more cases in the past 14 days. Running down the list of schools in our area, Jefferson West Elementary had 5 cases. Riley County Schools 17. USD 377 Effingham had 5. USD 429 pre-K through 8 in Troy, they had several cases. Valley Falls Elementary second graders had 6 cases. Valley Heights Junior High School in Blue Rapids with 9. Also, an outbreak among the Seaman Middle School wrestling team grew from 10 cases last week to 14 this week. And a couple other area exposure locations, home daycare in Emporia, Riley County Public Works, and a couple long-term care facilities, Brewster Place in Topeka and Good Samaritan Valley Vista in Wamego. Now, the numbers come as Governor Laura Kelly announced all fully vaccinated Kansans are now eligible for those COVID-19 booster shots. This puts the state ahead of federal health officials. The CDC plans to discuss expanding boosters Friday. But in Kansas, anyone age 18 and older who got the Pfizer and Moderna COVID-19 vaccines 6 months ago or the Johnson & Johnson vaccine 2 months ago can get a COVID booster. You'll hear from KDHE Secretary Dr. Lee Norman about why those boosters are considered so important coming up on our news at 6. And remember, you can find a vaccine site near you on WIBW.com under the COVID-19 resources page. With just a week to go before Thanksgiving, the U.S. is still in the grips of the pandemic. CDC data continues to show a lot of red, high community transmission levels. Cases of COVID-19 are on the rise as the FDA moves toward expanding the eligibility for those vaccine boosters nationwide. Naomi Ruckham has the update. He would still like to be part of state government and believes we cannot let our guard down against COVID. Dr. Lee Norman sat down with us exclusively today, confirming he was fired from his job as Health and Environment Secretary.
I feel really good about what we've accomplished as a state, as an agency, myself personally. I'm not having a hard time sleeping at night.
Were you ready to step down?
I did not step down voluntarily. I was asked to step down. So no, I wasn't prepared to do that.
Dr. Lee Norman's 3-year tenure as KDHE Secretary, leading the state through the COVID-19 pandemic, came to an abrupt end Friday with a news release from the governor announcing his departure. What was the tipping point, do you think?
I don't know. You'd have to ask the governor that, or her staff.
Norman acknowledged email exchanges with Governor Kelly's chief of staff, Will Lawrence, in which Lawrence warned Norman his public comments could be undermining policy efforts and scaled back Norman's media appearances. Norman says he didn't think he was getting political.
It is true that public health is political, but it shouldn't be as partisan as it has become. But I think I did rub him the wrong way. But no confusion about this. Respect him, liked working with him and the rest of the governor's office staff. When you're busy running day-to-day operations in the middle of the largest infectious disease mass casualty event in the history of the United States, just to put things in perspective, running day-to-day operations when it gets into policy, then that's kind of get a little pushback, and that's what you saw. There is a difference, and this was actually, I think, the fundamental difference of opinion. I wanted to be more transparent with any information we have, trusting the public to take that information and do what they wish with it. I think that the governor's office wanted to script it a little bit more tightly than that. And I think it worried them that I was going to divulge information that they were just not quite ready to have divulged yet.
Norman also was known for calling out misinformation and public officials on social media. House Speaker Ron Reichman recently tweeted condemning comments during a legislative hearing in which people compared restrictions for the unvaccinated to the Holocaust. Norman replied, questioning who allowed the public venue for expressing those views.
I basically have always said what I wanted to say. You know, the words that are come out of my mouth are my words. Now, if they have a consequence that I can't foresee and somebody gets bruised, sorry. But I think it's important to really state one's mind.
The information he wants people to know today, the pandemic isn't over.
We can't let our guard down during these upcoming weeks, really. From now till the first of the year, I think are going to be a big question mark.
At the end of the day, do you still support Governor Kelly's administration and Governor Kelly's efforts?
Yes, very much so. Matter of fact, I think that her response to this pandemic has been a model of success.
As for his role in that response, Norman says he has no regrets.
I'm not a victim. I might be a casualty of what's happened. I don't second guess how I've gotten here. If I would have been on the sidelines, I would have been fit to be tied. You know, put me in, coach.
We had reached out to the governor's office several times over the past few days for a response to Norman's departure. They have not commented yet beyond that initial news release thanking him for his service. As for what's next, Dr. Norman isn't sure. He remains on the faculty of KU School of Medicine and says he loves to teach.